Hello, folks. Welcome to the MMOA Podcast. My name is Dustin Jones, one of the older adult faculty with the Institute of Clinical Excellence. And today we have Mariana Wingood, Dr. Wingood, PhD, PT, DPT, MPH, all kinds of letters behind her name. Mariana, we go way back. Remember the Twitter days, right?
Yeah.
But Mariana, she is at Wake Forest currently down in the beautiful town of Winston-Salem, North Carolina. And Mariana, we connected several years ago through the common just interest in geriatrics and older adults. But what I've loved is with your career, Mariana, just I wouldn't say shift per se, but just your emphasis on how do we get people moving, physical activity especially in different clinical settings, different practices, like how do we as providers help people increase physical activity, which as evidence has emerged has been so important. So I appreciate you taking the time to talk about your newest publication. I'll go ahead and read the title of it: Identifying Potential Determinants That Can Impact the Implementation of a Physical Activity Pathway in Outpatient Physical Therapy, a Mixed Method Study that was recently published in PTJ. Now, I want to start off, Mariana, with your kind of career trajectory where, you're a board certified, geriatric specialist. You're very active in the Academy of Geriatric Physical Therapy. Was there like a moment or an occurrence or something that really shifted your focus on physical activity in general, right? Like, was there a
Yeah.
a study, something that really like inspired you? Like, man, I really want to solve like this particular problem, a very important problem with the folks that we're trying to serve.
Yeah, it's a great question. I think it's a topic I've always been passionate about as someone who is physically active. And most of my treatment career, clinical care career, was within the state of Vermont. And there, moving to North Carolina has been quite a shift in my patient population. And in Vermont, I noticed that I had two sets of patients. 75% of those patients were people that were coming to me for direct access PT because of a skiing injury or
Hmm.
sport related. And then the other set was older adults who have had multiple falls, struggling with frailty. And when I looked at the quality of life between the two and the aspects that they are enjoying or struggling with, it all came down to how active they are and the consequences they have experienced from being inadequately active. So that's really my passion, and it's kind of been my motivator, my carrot in a way on this lifetime journey. And then in clinical care, I just really realized that as clinicians, we do a really great job of addressing the impairments that are associated with the falls and the frailty, and then we discharge them, but we don't often set them up for success. We don't address those modifiable factors that resulted in that decrease in strength and functional endurance and other aspects, that lack of physical activity. So I really wanted to see what can we do better as clinicians.
That's so cool because your experience is like the exact opposite of mine, in the sense of like your 75% of the folks that you worked with were like my 5%. And 95% of the folks were just really struggling with a lot of negative health outcomes that were preventable, like a lot of preventable suffering. And that was a big motivator for me. And so like these unicorns, I view them as unicorns, but they're the norm up there in
Yeah.
Vermont. I know we can say the same about other parts of the country, but that's just really cool to see and acknowledge. And I think for those that maybe, if you're in an area like me, like I'm in Kentucky, like there's places where it's switched, or if you're only in Vermont or certain like mountain towns in Colorado, that there's places like Kentucky where it's, the exact opposite, where sedentary behavior is a huge issue. And you may not experience that as a clinician, depending on where you are. That's awesome. So you're down in North Carolina, a little different culturally. And so with this study, so identifying potential determinants that can impact the implementation of a physical activity pathway in outpatient physical therapy. I love the kind of zoom in and focus on outpatient, because I think it has maybe different challenges than other settings. Like, I think in the home, like your ability to go into someone's house to assess and see so many variables that could influence physical activity in their life. But then also, like, the opportunity to build relationships is pretty great because you're in their home for an extended period of time versus like outpatient. It's very different. It's like a whole different set. I would think of barriers. So what for the outpatient clinicians, like what were some of the things that you uncovered with this publication that were kind of surprising to you?
Yeah. And I should, back up, like, how did I get to this publication to begin with a little bit?
Yeah, yeah.
And, this work started really when I started my PhD in 2018, when I looked at how are clinicians assessing and addressing inadequate physical activity. And at that point, I identified that really we are not. Outside of educating people to be more active, and I've been told many times that I should do things in life, and I don't always follow them because education is just inadequate to change someone's behavior. So I looked into it more, and one of the top barriers was that clinicians felt like there was a lack of standardization and a lack of guidance of how do we address inadequate physical activity. So I spent a couple of years creating this physical activity pathway, which provides guidance on how to assess and address inadequate physical activity. And then I focused this study that is published in PTJ on what are barriers to implementing this pathway in clinical care. And, there was a couple barriers that really screamed out, but in general, there was way more facilitators than barriers,
Mm.
which was exciting to see. For example, the only barriers really that were voiced by the participants was related to Medicare coverage, and that Medicare primarily cares about function, and that once we return a patient to its prior level of function, it's hard to get continued Medicare coverage.
So the patients
Interestingly,
acknowledge that limitation.
yes. The
Man.
providers, yeah, and the patients both. Interestingly, when I interview clinicians that regularly address inadequate physical activity, they don't voice that as a barrier at all because they can tie the physical activity to the function piece, and really focus it on that way. And then the other really barriers related to implementing the physical activity pathway was lack of knowledge and access to knowledge. And that really came through when I did a knowledge assessment, where during the knowledge assessment, we found that unfortunately about 84% of the participants, the 51 participants, couldn't identify what physical activity is. They couldn't define it. And unfortunately, 98% of individuals did not know what the physical activity prescription for older adults are. What is the recommended amount of physical activity? And I think part of that is that the guidelines were updated in 2018, and a lot of individuals still verbalize the prior guidelines, missing especially the multi-component balance aspect that should be done weekly. A lot of them miss the strength training component. The number one response was 30 minutes, 5 days a week, which equals to the 150 minutes of moderate to vigorous. But there was less awareness that you don't have to do 30 minutes at a time. It can be broken down. People were unaware of the strength training and the balance piece. And that's really been the focus, my entire career. I feel like I started with continuing education courses because I noticed there was a gap in knowledge. So that is definitely a big piece, but there are other barriers such as the Medicare issue. And then also documentation is not really great for physical activity aspects.
Interesting. So what were the activity guidelines prior to 2018?
Yeah,
And then
so
what are they now, just so we're
they
all on
did
the same
not
page?
include the multi-component
Okay.
exercise or physical activity, so having that balance. Strength training was also not pushed as much. And to be honest, I think the more literature we have, the more strength training and balance is going to be promoted as a guideline for older adults. I have a dear friend and exercise physiology background who is like, well, if the patient can't get out of the chair, they can't go do their aerobic activity. So that strength to him, that strength training is just the essential part of any movement, which I agree. I do think that you can do strength training or aerobic activity in sitting, but his point is valid. So I think it's going to be more and more big part of the guidelines.
Yeah, yeah. Um, yeah. Now it's just kind of like, and do this a couple times a week versus really highlighting it, like the more the aerobic piece or the consistent volume that we're preaching. So what are your like big recommendations for outpatient clinicians? Like, especially I think about some of the folks that, they got 30, maybe 45 minutes with some of their folks in terms of, that interaction. They may be seeing multiple folks all at once, kind of all over the board in terms of how often they're seeing folks. What are like some of the big actionables that you think they can take to really move the needle for their patients?
Yeah, 100%. There's a number of actionable items we can do in our outpatient clinics. The first piece is that we go beyond just educating or telling someone to be more active, going to the next step. And what does that look like? Many individuals think of motivational interviewing. However, research continues to show that providers don't have enough training in motivational interviewing to use it efficiently and really effectively in clinical practice. So, what does that leave us with? There's a whole world of behavior change techniques and research, which can be extremely overwhelming. So, as Dr. Stephen Cole, who is a psychologist, developed, or psychiatrist, I'm sorry, developed what's called brief action planning, which is a structured motivational interviewing tool that basically has patients set goals and have action plans to accomplish those goals. And it's something that we can do in 5-10 minutes for the clinics where I'm implementing it. We even have a handout for patients that they can take home, and the patients can create an action plan at home and then bring it back and discuss it with the PT to really address that barrier of time that's often voiced. But it starts with a simple question such as, is there anything between now and your next session you would like to do to related to your physical activity levels? Um, if they say no, we know that based on the changes, behavior change stages, these individuals are really not contemplating or ready to increase physical activity, and it's our job to respect that. Those are not the people we're going to increase their physical activity at that time. We just acknowledge that they're not ready for it and ask them permission to discuss it later down the line. And that's really a big part of motivational interviewing, is always to ask permission prior to providing information.
Man, that's hard.
It is. It is. And we're so guilty of it, even with home exercise programs. Here's your program.
Yeah.
Have a nice day.
Yep.
But so there's that part. If they say, yes, I would like to do something, you look into what are their goals and then how are they going to accomplish them. And setting action plans is really patient driven. We are very good at being like, oh, you should do 20 minutes next week of aerobic or do strength training twice. But having them create the plan has been really eye opening. And most of my patients, the initial plan can be such as, I'm going to find sneakers that I can start a walking program in.
Mm.
I'm gonna find my Fitbit that my granddaughter gave me 2 years ago. And some of them are, I'm gonna walk to the end of my driveway, on a daily basis to get the mail instead of driving down there. And then really the big part of action planning is digging deep into those details. The more details someone creates for a plan, the more likely they are to succeed. And it's
Mm.
like that for anyone. Like, I'm gonna run a marathon someday versus I'm gonna run a marathon on October 10th this year. It will be in Chicago. This is my goal. You're much more likely to then sign up for that marathon than saying, I'm gonna run a marathon someday. I realize that's a totally
Yeah.
very large goal and plan, but it brings home the point. So for someone that's doing the driveway walk, you ask what time of day they're going to do this walk, how many times a week, and then really dive deep into it. And then once they have an action plan, you have to assess how confident they are in completing that action plan. And that's something I've even started doing with like home exercise programs in general. And I say something such as on a scale 0 to 10, 0 being not at all confident and 10 being 100% confident, how confident are you that you can do this plan or this home exercise program? And if they say above a 7, I know that they are confident in that plan and they're much more likely to achieve it. If it's less than 7, we will modify the plan. And it's also what I do for home exercise programs. So if they say they're not confident in their home exercise program, we figure out why. If it's the frequency, like doing it every day, we decrease the frequency or whatever it may be. But it's a kind of shared decision making that we work on together till we get to a plan that they feel confident in.
Yeah, man. That's such a huge piece. I love that you said that because I think for many of us that are probably watching or listening that, you know, we've we've drank the Kool-Aid, if you will. Like we believe in the power of physical activity. I mean, we're physical therapists, right? So many of us are partaking in regular physical activity, fitness, whatever your thing is. And, you mentioned that goal of the marathon, right? Like, and that is a big goal. Uh, but the end of the driveway is the equivalent for a lot of these
Yeah,
folks. And I think it's
100%.
very, very easy to forget that and to give those goals that are seemingly simple the weight that they deserve. And the only way that we're going to do that is if we assess their confidence, if we understand their perception of those things. And man, when we can kind of get in their shoes, yeah, our ability to break that down, to make it approachable, to increase the buy-in for that is imperative.
Yeah.
I think about that too with like resistance training progressions, where let's say if we've got our classic, pastel dumbbell tree and, they're starting off with 2 pounds, whatever movement it is, and they're absolutely crushing it. It's very easy for us to like, oh, I'm just going to grab the 4 or 5 pound dumbbell, right? But for those individuals, that may have been like a 60% increase compared to their capacity, right? Like that's a huge jump. Like you probably wouldn't do that if you were training a movement, right? But it's just easy to forget where folks are and to yeah, just appropriately progress or make suggestions where based on where they are versus like what our perceptions are.
Yeah. And you know what you also like achieving that driveway walk or achieving that 2 pound dumbbell exercise boosts their self confidence and the ability to do more.
Mhm.
And confidence in one's ability is the number one predictor of doing it down the line. If we set up our patients for failure by giving them too much because we think that's what they should be able to do, they're less likely to do it, A, because they're not confident in it. And if they try and fail, their confidence gets even lower. So I'm all about setting up our patients for success. And what looks like success is defined by them. Um, and that's an essential part. Yeah. And definitely a way I have changed my clinical practice because I used to be like, I'm going to get everyone active. All my older adults are going to run the local K and
Yeah.
start skiing. But that's not reality. And it's also not really patient centered care or person centered care. So, really figuring out what matters to them and what are goals that they
Yeah.
would like to achieve is essential.
Yeah. It may be reality in Burlington, Vermont. I don't know. So this is a selfish question, but I have recently been heavily influenced by tracking my steps in a day and playing around with an app. It's called Step Up. It's like this free app, and you can create leaderboards. And we've done it here at ICE, and I've got like a bunch of neighborhood friends, and just like the gamification of
Hmm.
it, like has created some pretty fun interactions where we've all kind of pushed each other to walk more than what we normally walk. And I've objectively seen that, with myself. And I'm curious what your take is of being someone that's, an expert in this area and understanding, how to increase physical activity. What's your take on technological solutions, apps, wearables? Like how do you think
Yeah.
outpatient clinicians can use or should they use it to help try and increase physical activity?
That's a great question. I actually was just part of a study that looked at wearables within physical therapy use and how we're using them because I think it's a tool that we underutilize a lot and it has a lot of potential. However, as an implementation scientist, I realized that one of the biggest barriers is I mean, we have a hard time keeping up with evidence. Good luck keeping up with technology. Like,
Yeah.
you feel like you're up to date, and then the next day you're out of date. And so I think that can be really challenging. I haven't figured out a good way to address that barrier. However, I think there are a number of apps, a number of wearables that you can use. I have used them not only for step counts and setting individual goals, the gamification and competition works for some people. However, you have to make sure they're in the correct group. I am someone that works out 12 hours Monday through Friday alone. I shouldn't be in a group with someone who's struggling to start being physically active because it's not gonna motivate them to be in the same group as me. So those small pieces should be considered, which makes it, there's just so many pieces to it. So I think like figuring out what is the patient's preference? How comfortable are they? That's first step. Second step is how can we use the wearables? So for some people, I don't use it as a step counter, but I use it for heart rate monitoring, realizing that it's not the most accurate heart rate monitoring option, but it helps people to know, am I working at a higher level? If I am someone who is struggling with shortness of breath, or struggling with cardiac related issues, it's a good way for me to feel more comfortable going out, knowing that I can keep an eye on my heart rate while walking, which is a barrier for many individuals. So figuring out how to use the wearables and then the apps, the simpler the app can be for people, the better it is, I find. I think there's a bajillion apps out there, and I think apps have gotten a little better at using what's called user-centered design or co-design, but a lot of them were designed by people who are active to begin with, and they're not always user-friendly or welcoming to people who are less active. I mean, there's always a joke about Garmin versus Apple, and Garmin watches tell you that you're unproductive and should do more, and failing at life versus Apple products are like, "Good job,
You're
you
doing
did it."
great.
So, like, even those small pieces, like, being aware of it, is,
Yeah.
I think, good.
Yeah. Yeah, man, the user-centric design, I've experienced that from the gym side of using apps to manage a fitness facility for folks over 55, and just they're not so much tech is not made for older adult consumption, and if it is made with them in mind, you know, the take an iPhone, the vast majority of folks that I work with, their font size, you know, is larger. And I cannot tell you how many features of an app that was like super thought out. When all the text size is normal, it works great. But as soon as it's, you know, doubled in size, that button is harder to push or it just ends up like completely off the screen. That it's pretty clear that, yeah, so older adults or someone that may have a visual impairment, for example, probably wasn't too involved in that process.
Yeah, 100%. And, using apps is a type of behavior change. Like, initiating to use an app is a change in one's behavior, and if one is not confident in it, they're not gonna initiate it. And research shows that I think about 75% of individuals 60 years and older now own a smart device, smartphone. And there's also this continued ageism, well, that older adults are just not pro technology and they don't wanna use technology. It's not what the research really shows. It's just that technology was not designed with them in mind for reasons like you mentioned. And even like website designs, how many clicks does it take to get somewhere? An older adult can get easier frustrated by it if it's not simple. Uh, Although I am also easily frustrated
Yes,
if it takes me
right
10
there.
clicks to get somewhere, but they have experienced the world differently than we did. And they always had solutions for their problems that were non technology solutions. Versus now, we live in a world where everything is really related to technology. And I can see how frustrating that can be. And I think we just need to take the time to involve them in developing it and also take the time to explain it to them.
Yeah, yeah, 100%. I agree with you 100%. And when it is done well, and it's matched with the person that is likely to use it and wants to use it, like it can be powerful. But I like your giving us a perspective. A lot of these apps and wearables and all the fun tech stuff is basically one of many tools in our toolbox and not the answer, right? For everything. I appreciate that perspective. So we mentioned a lot of things, a lot of resources, a lot of links for listeners and viewers. All of these links that we mentioned are going to be in the show notes, so don't worry about that. You'll be able to access that, and I really want to make sure people get their hands on that physical activity pathway that you published and mentioned previously. With just we'll wrap things up here, and I want to just give you the floor to speak to clinicians, and I would love for you to just if you could just share like someone that you know, just think about that clinician that's just like they're swamped, right? They're probably reducing pain. They're getting people back to their prior level of function. But man, they know there's more to this, right? There's more impact to be had. They can continue to change lives and maybe even a greater way than what they are currently, which is probably hard for a lot of people to perceive. What encouragement, what words would you give to that person if they are wanting to incorporate more, physical activity focused care for their patients?
Yeah, it's a great question. I think number one piece is remembering that it's not for everyone, not every patient. And just having that conversation with the patient. For individuals who are ready to become more active, utilizing simple goal setting and not you as a clinician setting the goal, but the patient setting a goal and then plans to accomplish that goal. I find it a really great way to wrap up a session of my PT session. It takes me 2, 3 minutes to ask about the goal between now and our next session and the plan to accomplish that goal, and I incorporate that into their home exercise program. And I use it in my goals. I have a self management goal. And for my patients with chronic pain, my patients who are frail, who are at risk at falls, all of them need a self management goal for post discharge. So I incorporate it into there. And that's how I justify taking the time within clinical care for that. And then I set up a check in as we get closer to discharge. I will decrease to once every 2 weeks. And that check-in is focused really on how are they doing with their physical activity and also the home exercise program they're continuing, and really slowly decreasing the amount of influence or the amount of time I spend with them and empowering the patient to just do things on their own. Of course, that's not for everyone, which is why I said that people who are just not ready for this part, it's okay to acknowledge that, and to really inform the patient that you're here for them when they are ready. Because I can tell you that most people just get frustrated by having everyone tell them to be more active. They hear it
Mm.
nowadays from a primary care provider, they hear it from family, they hear it from public messaging. It's not that people don't know that we need to be active, it's that there's other aspects to it. And I think the other takeaway is that we can easily, there's people always say they don't have time. There's a lot of discussion, is it really time or is it prioritization of how you run a day? In the end, it doesn't really matter fully because we as PTs can't tell someone that they should prioritize physical activity and their health when they're struggling to put food on the table, and needing to do 5 jobs and caregiving for their loved one or whatever it may be. And for those individuals, like, their journey to physical activity is setting them up with community resources.
Mm.
And I know that social work, I love my social workers, but there's such shortage of them, and we end up doing a lot of social work within our clinical care, which can be frustrated when you have limited time. But sometimes it's really the best thing you can do for the patient, especially when we think about aspects that impact chronic pain that are non-physical. So it's a lot to leave someone with, but those are just some of my thoughts.
Yeah, yeah, and I think that's empowering, like, just to acknowledge that the scope of impact that we can have in all settings, right? But, yeah, definitely for the outpatient clinicians, like, there's so many things that you can directly address, indirectly address, get some type of care pathway rolling that a lot sooner than maybe what other providers would be able to initiate, is like a huge, huge opportunity.
Yeah, and we are the
Yeah.
movement experts when it comes down to it, and we get to see our patients much more than their primary care provider see their patients.
Oh my gosh. Yeah.
And so it's within our scope, it's within our power, and we can make a big difference in our patients' lives.
Yeah. 100%. 100%. I love it. Dr. Wingood, thank you
Thank you.
for your perspective. Thank you for this line of research. that's just so needed. And I think there's a lot of talk about it. There's a lot of recommendations on what we should do, but the to have evidence behind it of like, all right, this is what actually works as opposed to your opinions or whatnot is super helpful. In the show notes, I'm going to link to some of your publications. Definitely the physical activity pathway, the most recent publication for the outpatient clinicians. Also, I want to link to the brief action planning that you mentioned with Dr. Cole, I believe. If if anyone does have any other questions or would want to connect with you, is there a preferred platform?
Yeah, I mean, I'm very easily searchable, but I happy to talk via email. I have left Twitter for the most part, and I am on LinkedIn and easily reached there. But I always appreciate talking to people, and I really appreciate being here with you today.
Awesome. I appreciate the time. I'll drop that link in the show notes as well. And Dr. Wingood, physical activity, lots of opportunity. And I think we're getting a lot more clarity on how we can be effective versus just educating and crossing our fingers. So I appreciate your career and all the effort that you're going in this area.
Thank you so much.
Awesome.